Okay, hi, this is my cousin Oscar, and in this video I'm going to be performing inspection, palpation, active, passive, and resistive ranges of motion of the cervical spine. So first I'm going to start off with inspection. So I'm going to be looking around your neck, and what I'm looking for is any redness, any inflammation, maybe if he has any glands or lymphatic that are inflamed or abnormal. Alright, so next I'm going to be palpating. Is there any area that's bothering you? Alright, so I'm going to be pressing on your neck. Let me know if you feel any discomfort, okay? Right, go ahead and relax your neck. So I'm first feeling for temperature changes. Alright. One. Alright. Then I'm going to start off with soft tissue palpation. And what I'm palpating is bony structures and soft tissue as well. Does that cause you any tenderness? No. Alright. Moving on into deep palpation. Is this tender? Yes. Okay. Perfect. Then I'm going to be moving on into active range of motion. Okay. Alright, sir. What I want you to do is go ahead and bring your chin to your chest. Alright. So just 50 there. And 10 there. So 40. That's normal. Or normal is 45 to 70 degrees. Alright. Go ahead and now what I want you to do is extend your neck all the way back. Okay, so 50 there, and 0 there. So if he has 50 degrees, normal should be around 60 to 75. All right, go back to neutral. Now, did any of those cause you any tenderness, or did that bother you at all, or change in symptoms? No? Okay. I'm zeroing them out. Now, go ahead and bring your left ear to your left shoulder. Now, left ear to your left shoulder, like that. Yeah. Okay, go back to neutral. All right, do it. Perfect. So 30 there, and 0. So he has 30 degrees. Normal should be around 45. Go ahead and bring your right ear to your right shoulder. Okay. And wait. We have 50 degrees there. And 10 degrees, so 40 as well. Okay. Now I'm going to check for rotation. Did that bother you at all? No, sir. No? All right. All right. Go ahead and look left. Alright, so he has 45 degrees. Go back to neutral. Good. Now look right. Alright. And he has 60 degrees, so just a little bit more. Did that bother you at all? No. No? Okay, normal should be 70 to 90 degrees. Alright, so since none of those movements bothered him, I'm going to be moving into passive palpation, passive active range of motion. So now I'm going to be moving your head around for you. Let me know if you feel any discomfort, okay? Alright. That feels like tissue stretch. Back. Tissue stretch. Okay, tissue stretch. Tissue stretch. Tissue stretch, and tissue stretch. Did that bother you at all? No, sir. No? Okay, so moving on into resistive ranges of motion. So, sir, what I want you to do is try to bring your chin to your chest and resist my motion. Okay, did that bother you? No. No? Okay. Now, what I want you to do is try to extend your neck back and resist my motion. So I'm going to be pushing you, and you try to push my hand back, just like that. Yeah. All right. Feels good. Now, that changed your symptoms? No. All right. Now try to bring your left ear, to your left shoulder. More. There you go. Perfect. Does that bother you? No. All right ear to your right shoulder. Okay. Does that bother you? No. Perfect. So that is active, passive, and resistive ranges of motion, as well as inspection and palpation of the cervical spine. Okay, so in this video I'm going to be performing O'Donoghue maneuver. Sir, does any side bother you at all?
No, sir.
Alright, so I'm going to be moving your head around for you first, and just let me know if that causes you any discomfort, okay? Okay, so first, moving his head into flexion. Does that bother you?
No.
Alright, now extension. Does that bother you?
No.
Okay, now lateral flexion. Does that bother you?
No.
No? Okay. Does that bother you?
No.
Okay. Now rotation. Does that bother you?
No.
Okay. Does that bother you? No. So I just said passive ranges of motion. If he had pain, that's indicative for a cervical sprain. Now I'm going to be doing resistive range of motion on you. So this time I'm going to ask you to do a motion, and then I'm going to be trying to resist that motion, okay? All right, so go ahead and try to bring your chin to your chest. All right, did that bother you?
No.
All right, now go ahead and extend your neck back. All right, did that bother you?
No, sir.
Okay, now try to bring your left ear to your left shoulder. Left, yeah, there you go. Okay, let me start again. Neutral, there you go. Left ear to your left shoulder. Does that bother you?
No, sir.
All right, right ear to your right shoulder now. Okay, does that bother you?
No.
No? Now, try to rotate to the right. A little harder. Rotate your head. Like this. Right? Rotate to the right. Does that bother you?
No, sir.
Now rotate to the left. Does that bother you?
No, sir.
So if he had said he felt pain in any of those resistive ranges of motion, that would be indicative for a cervical strain. Okay, so this video is on the shoulder abduction test, also known as Bakode sign. Sir, do you feel any pain around your neck area?
No, sir.
Okay, so this would be done if he had pain, but for the sake of this video, I'm going to ask, go ahead and put your right hand on top of your head, just like this. Did that cause you any change in symptoms? No? Now do it again with your left hand. Any change in symptoms? No. So if he had relief of his symptoms, that would be indicative of a radiculopathy, specifically around C4, C5, or C5, C6. So that's the shoulder abduction test. Bakode sign is when the patient walks into your office with their hands like this. They're saying that they're doing it because this makes them feel better. And if they lower their hands, they feel the pain. Okay? Alright, this is Jackson's compression test. Sir, do you feel any pain in your neck area? No? Okay, for the sake of this video, I'm going to do it. What I want you to do is turn to your right. I'm going to be applying some pressure. Let me know if that causes you any changes in your symptoms. Okay? Alright. Does that bother you?
No, sir.
Alright, now look to your left. Alright, does that bother you?
No, sir.
No? So, a positive test would be radicular type pain, so something like tingling or any sensation like that. And that would be indicative of a radiculopathy. Alright, this video is on foraminal compression test, aka Sperling's test. So, do you feel any pain or any symptoms in your neck?
No, sir.
Alright, let me know if you do. I'm going to be applying some pressure onto your neck, okay? Alright. Alright, so does that cause you any pain?
No, sir.
Alright, now what I want you to do is look up. Just a little bit like that, perfect. Any pain?
No, sir.
Alright, now with your head in extension, go ahead and rotate to the right. So neutral. So go back to neutral, and then extend your head back. Okay, so let me do it for you. Extension and rotation. Alright. Any change in symptoms?
No, sir.
Alright, extension and rotation to the left. Okay, any change in symptoms?
No, sir.
Okay, so this would be a positive test for if he had any radicular type of pain, such as numbness or tingling, going down his arms, and this is indicative of a cervical radiculopathy. Alright, this is the shoulder depression test. So, do you feel any pain around your neck area?
No, sir.
Any around your arms, shoulders? No? Alright, so I'm going to be moving your neck around, pressing onto your shoulder. Let me know if that causes you any pain or changing symptoms, okay?
Okay, sir.
Alright, so first, I'm going to be moving your left ear to your left shoulder, stabilizing that position, and then depressing the shoulder down. Does that cause you any pain?
No, sir.
No? Alright, now I'm going to be moving it to the right, stabilize that position, press the shoulder down. Any pain?
No, sir.
Okay, so this test would be positive if he had either localized pain, which is indicative of it could be a muscle spasm, muscle tightness, sprain or strain, or it would also be positive if he had radicular type of pain, which would be indicative of a problem in the disc, an adhesion, stenosis, or thoracic outlet syndrome. Alright, this next test is called the cervical distraction test. Sir, do you feel any pain around your neck area?
No, sir.
Okay, I'm going to be lifting up your head. Let me know if that causes you any pain or changes in your symptoms, okay? Alright? Alright, does that cause you any pain?
Yes.
Okay. So this test is positive in this case because he had pain, and that would be indicative of a muscle, sprain or strain, something going on there. It would also be positive for if he had relief of pain. Relief of pain is indicative of a radiculopathy or facet imbrication. Okay, this is called the upper cervical quadrant test. Do you feel any pain in your neck area?
No, sir.
No? Alright, so I'm going to be moving your head around and then applying pressure. Let me know if that bothers you at all, okay?
Yes.
So go ahead and stick your chin out like this. No, like forward like this. Perfect. And then bring your right ear to your right shoulder and then rotate to that side. Rotate your head without moving your shoulders. There you go. There you go. Alright? Does that cause you any pain?
No, sir.
No? Alright. Now go ahead and go back to neutral. Stick your chin out and then bring your left ear to your left. First left ear to your left shoulder and then rotate. Okay? Any pain?
No, sir.
No? So this test would be positive if he had any pain, radicular type of pain, and that would be indicative of a radiculopathy. Specifically in the upper cervical area, C1 to C3. Alright, this is called the Valsalva maneuver. Sorry about that. Now, sir, in this test, I want you to go ahead and bear down as if you were going to the restroom, but hold it. Alright, did that cause you any pain?
No, sir.
Changes in your symptoms? No? So it would be, this test is positive if he had extreme pain or extraspinal pain, and that is indicative of a space occupying lesion such as a stenosis or a tumor of some sort. Okay, this is called the maximal foraminal compression test. Sir, do you feel any pain around your neck area?
No, sir.
No? Alright, what I want you to do is bring your right ear to your right shoulder and then go ahead and rotate your head to the right. And in some cases, that's the end of the test, but others, we extend as well. So go ahead and look up and then apply actual compression. Does that bother you?
No, sir.
No? All right, and then now go ahead and bring your left ear to your left shoulder, rotate your head, and look up. Okay? Does that bother you?
A little bit.
A little bit?
Yes.
Okay, does the pain travel down to your arm?
No, sir.
It's just there?
Yes, sir.
Okay, sorry about that. All right, so This test is positive if he had localized pain in the joint, which is indicative of a joint pathology, which is, in this case, a positive test for that. It's also positive if he had pain, localized pain in the opposite side, and that would be indicative of a sprain or strain. Lastly, it's indicative if he had radicular type pain on the compression side, and that's indicative of a radiculopathy. All right, this is called the brachial plexus test. What I want you to do is bring your arms out like this. So notice his elbows are extended, arms are in external rotation. Now what I want you to do is bring your arms up until you feel your symptoms. There. Okay, does that bother you?
Yes.
Okay, so bring them down a little bit. Is that better?
Yes.
Okay, so now what I want you to do is bring your hands and touch your head. Does that reproduce your symptoms?
No.
No? Okay, perfect. So if that reproduced, if that test would, you can go ahead and relax. If that test would reproduce the symptoms with radicular pain, such as like tingling sensations down his arm, then that would be a positive test, and that would be indicative of a problem with the ulnar nerve or radiculopathy, again in the ulnar nerve, or C8 or T1. Alright, this next one is not so much a test, it's rather a sign. It's called the rust sign. It's when a patient presents lifting up their head like that, and that is because if they let go, they feel severe cervical instability, and that's the problem. So if a patient presents like this, and they feel that if they don't hold their head up, something is going to happen, immediately send them to the ER. Possible cervical instability of any kind. Alright, this video is on both arm mensuration and forearm mensuration. So I'm going to start in his right arm. So I find a bony prominence, and then I want to measure the thickest part of his arm. So I'm just going to probably around 3 inches up. Measure. It's 9.5 inches. Now his forearm, I do the same. 2 inches up. 2 inches down, I mean. And it's 8 and 3/4. Now I do the same. I use the same measurement, so I go on the bony structure. Then for his arm, I did 3 on his right side, so I'm going to do 3 as well. Can you lift this part up? Yes, sir. Thank you very much. Alright. And 9.5 as well, so that is the same. And here I do the same, 2 inches down. And that is 8 3/4. So he had the same measurements. Positive or a problem would be if there was a 1 inch difference in the measurements of either the arm or the forearm, or if the dominant side. Are you right-handed or left-handed? Right-handed. Okay, so if his right hand or forearm, right arm or forearm was decreased, smaller in size, and that's indicative for atrophy, or if it's bigger, 1 inch difference, it could be hypertrophy, and that stuff.